We're here at Dr. George Weiss's office at the Wellness and Longevity Medical Center. We're creating thousands of microtraumas and wounds. We're using an array of 12 32 gauge needles to penetrate the skin at different depths to achieve different clinical outcomes. And those outcomes and things that we can treat is acne, acne scars, stretch marks, fine lines, wrinkles, and textural issues, especially pigment. What we're going to be doing today is for fine lines and textural changes in the patient's skin. First, we're going to apply the PRP to the skin and then drive it through into the skin utilizing the Eclipse MicroPen.
We have spun her blood down to plasma, platelet-rich plasma. Now what I'm doing is I'm adding chloride glutamate to her plasma, and what this does is it kind of says her cells have had an injury and they immediately start to rejuvenate. So we have about 10 minutes to topically apply the platelet-rich plasma and then begin the procedure. Now, with the MicroPen, we are going to do 2 to 4 passes over the patient. We're going to start with a horizontal pass, and while we're doing this, we'll want to kind of taunt the skin a bit. How are you feeling, Catherine?
Great, you can barely feel it.
All right, so now we are going to apply the PRP to the patient's upper lip and chin, and then we will begin micropinning. And lastly, we will finish up the micropinning on Catherine's nose. So that was our demonstration today using a MicroPen with PRP. If you would like more information or if you would like to become a patient, please contact our office at 858-459-7100, the Wellness and Longevity Medical Center with Dr. Weiss.
I feel wonderful right now. My skin feels really tight, and it feels like I feels like my pore size has diminished quite a bit. I was really worried about that, and it's been a great experience. It feels like if you've had microdermabrasion before, a little bit of a cat licking you, scratching. So it wasn't even uncomfortable. I didn't even use numbing cream at all. And the reason why I had the PRP done instead of hyaluronic acid is because I like the idea of having the platelet-rich plasma being embedded in my skin without doing injections. So that's kind of nice about the MicroPen. And I've been having breakouts, and doing the MicroPen actually is a wound healing, so it helps the breakouts. Even if you are broken out, as you can see, my face is a little bit. During this time, it helps the wound healing process, so it's highly recommended with that too. So I'm excited about that.